Hello and welcome to Adulting Anonymous. My name is Kudzai, your host, and I'm so glad you could tune in and listen to this episode. If you are new here or if you're returning and you just don't know, Adulting Anonymous is a platform where we tackle conversations that normal adults don't want to do on a daily basis. And we basically just tackle these conversations in an aim to assist you or to just make you feel like you are not alone. So, on today's episode, I'm excited because we are discussing a topic that is close to my heart. And if you've been following us, we've already had two episodes on this topic this month. And May is the month, is health awareness month. And we thought, what a better way to end off the month than bringing a qualified psychologist to help us with our mental health and to just shed some light on different aspects to this wide topic. So, today on my podcast, I am joined by Dr. Lize. And before we go into anything, I'm just going to hand over to her and she's going to introduce herself.
Thank you. It's lovely to be on your podcast today.
Thank
I'm a counseling psychologist. I've practices in Northcliffe and in Kailami, and I have a special interest in trauma and obviously in mental health. So it's wonderful to be able to talk about mental health, especially um, during this particular time that we're finding ourselves in and where mental health in particular is being challenged.
Thank you for introducing yourself. So before we dive into, like you mentioned, a very important thing of mental health in during COVID-19, before we dive into that, can I please just ask, how did you become a counseling psychologist? Was it something that you always wanted to do, or like what drove you to this career?
Sure, that's an interesting question. And since I am like almost 50 years old, I really now have to cast my memory back. Well, I always found myself in a position where all my friends came to me to talk about their problems. And and yes, then it just so happened that I started to study psychology. I wanted to actually become a dentist or a
Wow.
physiotherapist, and then I was
Okay,
too
so
late.
you've always wanted to help people. That's a
Yes.
common trend. Yeah.
Yes, and I was too late for the selection, so I started psychology. And but today I know that that was my particular path. That
Ah, that's
it's part
beautiful.
of my purpose to help people from here to there, wherever here is and wherever there is.
Even there is. Ah,
Yes,
that's so beautiful.
it's
That is beautiful. So, that's interesting because, like, people always say, I wanted to be an accountant, and then they end up becoming something that's totally outside, let's say, numbers. But you are like dentist, psychologist, so basically there's a common trend there. So well
yes.
done. Well done.
Thank
So,
you.
just to dive into the conversation, can you please tell us from an expert's point of view for anyone who's listening and has no idea or cannot identify what is, in your words, what is mental health? And I guess you can also just dive into the different types of mental illnesses that may be there, that are there. Sorry.
Okay. So mental health refers to cognitive, behavioral, and emotional well-being. In other words, it's all about how people think, feel, and behave. And
Mm,
according to the World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can work productively, and is able to
mhm.
make a contribution to his or her community. Okay.
Okay.
So mental health affects our daily living, our relationships, our physical being. Okay. In fact, it affects
Mm,
our whole being in the world. And that is why I
yeah,
believe that mental illness is the worst kind of illness to have because, you know,
it affects
it
everything.
affects everything, literally our being in
Mm.
this world. you know.
Okay.
Um,
Yeah, so I'm getting a trend of holistic wellness when you say that our physical, our emotional, our mental, it's like a whole holistic wellness that needs to be present in one's body or in one's being
yes.
to ensure that you are mentally healthy. Okay.
Absolutely. And it depends on a delicate balance of factors. There's various factors in our lives that contribute to a disruption in our mental health, like ongoing financial concerns, problematic interpersonal relationships, social isolation, socioeconomic conditions such as availability of employment, work-related
Mm,
factors, physical illness, um,
mm,
chronic pain, death of loved ones, genetic
okay.
family history, all of those things.
Okay.
And
That is
viruses.
interesting.
And
Virus,
viruses. COVID.
19.
Yes.
Okay, so you've spoken actually on something important, which is the causes of mental illnesses. I want to just take a step back. What types of mental illnesses are there out there?
Okay, so
I know, yeah,
so there
just
there are so many, and historically,
mm,
the two broad categories of mental disorders are neurosis and psychosis. And
okay.
neurosis, being defined as a chronic disorder characterized mainly by anxiety, and then psychosis, which is defined as grossly impaired reality testing, where people
Mm-hmm,
incorrectly evaluate the accuracy of their own perceptions and thoughts, you know. Um,
mm, mm,
but if we look at the most common types of mental disorders, those would be anxiety disorders and mood disorders. Mm.
okay. That is so interesting. Thank you for sharing. Very insightful.
Mhm.
I also just want to ask, in these, like you've mentioned a few mental illnesses, you've mentioned the causes, but there's also, I know I come from a background where most people don't believe that mental illnesses or when you like anxiety, depression, they don't believe it's a thing. They
Mm.
either label you as being lazy, or you just don't want to talk to people, or you're being rude what would you say are the, let's say, the most common stigmas surrounding mental health that you've come across as a professional?
Yeah, so there are three major stigmas, and that's been identified in studies, particular, and that I've seen in my practices as well, and just in general. It's almost on the one hand, there's the people with mental illness should be feared and kept out of communities.
Wow.
There's the thing that people with severe mental illness are irresponsible, so they should not be allowed to
Wow.
make decisions,
Mm,
and people should make it for them. And that people with mental illness are childlike and need to be cared for. And it also seems like the public, tends to disapprove of person with psychiatric disabilities much more than people who has physical illnesses.
yes, I was about to say, like, if you are going to say a person with a mental illness is dangerous or is not responsible enough, have you ever looked at a person with a broken leg and said, oh my gosh, you are now suddenly dangerous to
Yes.
society or you are irresponsible? So there's a lot of misconception. Thank you for sharing those stigmas. And
Mm.
I guess, how do you think we can debug these stigmas? How can we, just get to a point where everyone knows that this is really not the case?
Yeah, it's about education, 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 because that is what banishes ignorance and provides information so that the public can make more informed decisions over mental illness. And it has been shown that participation in education programs on mental illness has led to improved
Mm-hmm.
attitudes. And it is also shown that stigma is reduced significantly when members of the general public meet people with mental illnesses who are able to hold down jobs or live as good citizens in the community. And I also
Wow.
think if you're a person suffering with mental illness, to take it upon yourself to educate
Mm.
people wherever you go. First start with your family and
Yeah.
educate them, and colleagues at work so that they can see, hey, this is just a human being, and she is very
A
capable of
normal
doing her
human
job,
being.
a normal human being. Yes, she suffers with
Yeah,
anxiety, or maybe she's bipolar 1 or bipolar 2, but she, is a well functioning, successful person, even though she's suffering with
yeah.
mental illness, you know?
That is so powerful. That is powerful. There is power. I always say there is power in sharing your story. Like you never know
Absolutely.
who, like what your contribution to demitting these stigmas is. That is so
Yes.
powerful. So you mentioned at the beginning of this podcast, you mentioned that viruses can
Yes.
be especially in the age that we're living in today. I mean, we were recently, not recently, but we are in lockdown, and it's not just specific to South Africa alone, but the world has been in lockdown. And whilst many countries are lifting the lockdowns and some have been declared corona free, I did notice that there were articles that there were articles that were surfacing or being shared from different news outlets, stating that the mental health effects of COVID-19 are actually a health crisis,
Yes,
and
absolutely.
that there's obviously been a huge spike in mental illness numbers, and just how people are struggling during this period. So would you like to walk us around how a virus can cause someone mental illness? And I guess you can just share a bit of insights, considering you're the professional.
Okay, so if we just take the whole working from home thing, the financial stress thing, the social distancing thing that has come
Mm,
along with the whole pandemic, let's take working from home. Now for many people it
mm,
has been a blessing not having to navigate traffic and being comfy at home surrounded by pets and family. But for others it has been
mm.
extremely stressful, especially for three groups of people, I think, namely like working mothers having to homeschool their
Yes,
offspring, meet deadlines, do all the housework, being these super moms and super women,
yes.
who might or not even might, because there are many of my patients who are feeling this, so I've got
Mm,
evidence of it. They're feeling overwhelmed, they're feeling irritable, anxious, depressed,
yeah,
and
yeah.
also extroverts are really battling because they thrive on the company of co-workers during the day, and they find it
Yes.
difficult to work
Those
on their
coffee
own.
breaks, the smoke
Yes,
breaks, yeah.
absolutely.
Mm,
And then single people living on their own, um,
yes, I'm
who
one of them.
yes, and and who used to completely rely on work for contact with other human beings are feeling very
Yeah, yeah.
lonely and isolated and depressed. And I hope you're not
Mm.
feeling as bad as some of my patients are at this
No, no.
point in
I have my days. I have my days. I
time.
have days where I wake up and it just feels like it's okay, like this is all you have known. And
Yes,
then I have days when I wake up and I don't even want to video call. I don't want to chat. I'm just so
yes,
miserable. So it
yes.
definitely has different days.
Yes,
It's different days.
and we'll talk just now. Perhaps we can talk about what to do with that. But another thing,
Yes.
yeah, another thing is the financial stress, and it's probably been the
Mm,
number one stress during lockdown, and it's getting worse as lockdown sort of continues. I mean, initially we thought
yeah.
that it was only going to be, what was it at first, 3 weeks, and
Yes.
I mean, it's been how many weeks now with you know many small businesses have had to close down. Many people have
Yeah.
lost their jobs. Many have had to settle for a salary cut, and they
Mhm. Mhm.
have been experiencing severe anxiety, feelings of helplessness, hopelessness, depression, and then
Mm.
yeah, this.
And that's very important. Like, if we can just focus on the financial aspect.
Mm,
I think what makes people sane is knowing that they can control their ability to contribute to their livelihoods, right? And
absolutely.
what this virus has done is has robbed certain people, most people, of this comfort or this surety to
Mm,
say, you know what, tomorrow I can wake up, I can go open my store, I can go and sell ABC, and I'll be able
yes,
to have income to survive. So
yes,
they've been robbed of this ability, and I guess also just not knowing when it will resume or when things will get back to normal, in inverted
yes,
commas, because we don't know if things would get back to normal.
Yes.
And I guess, would you say like uncertainty
Mm.
is one of the contributors to you feeling anxious, and obviously other illnesses that may come with anxiety as well?
Absolutely, absolutely. It's the uncertainty of unpredictability, you know. So
Mm,
if we knew, you know, by the end of the month, this is what I do, this is what I'll be able to earn, this is what I'll be able to do, it's going to be over, this is how it's
mm,
going to look like. But we have none of that. We don't know when we're going to move from
yeah.
phase 4 to phase 3, and you know, are we then going to go
Mm,
back to phase 5? You know,
mm.
so absolutely, uncertainty
Okay.
is not good for us.
It's not good for human beings.
No.
I always say on my podcast, for me, what has helped me with uncertainty and obviously the unpredictability element of the that has come with this virus is just surrendering my ability to control, knowing that I don't belong to myself. So in my instance, I am a Christian,
Mm,
and so I surrender my life to God. And I always encourage people, depending on with the higher spirit or the higher power that you believe in. I
mm,
guess it's just always to believe that things will work out, eventually to work out for your good, and try to look at the just shifting your perspective and just always staying positive would help.
yes.
Like in as much as uncertainty can have negative effects
Mm,
and negative outcomes, if
mm,
you try to think of uncertainty and that the eventual outcome being positive, it also keeps you going, it helps you. But I am no expert,
mm.
hence I'm here with you, and I guess you can then just help us navigate what can we do to obviously to take on the effect of uncertainty in the midst of a virus.
Mm,
What daily habits do you think we can adapt
mm,
to ensure sound mental health?
Well, I think, you know, just to add on to what you've said, I think we must realize and say to ourselves, you know, this too shall pass. And we need to then, you know, sort of think of all those things that we can still control. You know, we can
Mm,
control our attitude, you know. Um, we
powerful.
we can control our daily routine, you know. We can
Mm,
control whether we decide to do some self-care and be good to ourselves and be kind to others and to reach
mm-hmm,
out to others and to, you know, have those certain family activities. And so there are many things that we can control, and
mm,
to focus on those, you know. But I think one of the first things that we need to do is just to own and name our difficult emotions, because lockdown, with all its challenges and the uncertainties, bring up many difficult emotions, you know, so, because we
yeah.
can't use busyness to run or hide from our emotions. Um, and we
Mm.
and we
And when we run from them, we can't deal with
we
them.
can't deal with them then, you know, and we have to view
Mm,
them as important and name them. When we don't own our difficult emotions, it also becomes more difficult to own our positive emotions like joy and gratitude and enthusiasm.
wow.
And when we,
Wow.
yeah, and when we have the courage to be present to these difficult emotions, that helps us to gain a sense of control and to feel less overwhelmed by these emotions. You see?
Oh, wow. That is so powerful. Like naming your I've never actually looked at it from that perspective, that
Mm,
when you're comfortable with naming your negative emotions, that also opens room and way for you to actually name the positive ones.
yes.
That is so powerful.
Yeah.
That is powerful. So,
And you know what?
thank you for sharing.
Yeah, you know, I just
Mm-hmm.
want to add what's wonderful about that is, as we continue to bring ourselves back to this uncomfortable space of difficult emotions, we start to develop our tolerance for being in difficult places, not running away from it or
Wow.
denying it, but facing it.
Mm-hmm.
And this is what is known as resilience,
Wow.
you know?
Wow. Okay. Okay,
Yeah.
because I think we are always trying to run away from the difficult situations. I guess I can speak for myself and say that is true.
Yes.
Always running. Okay. So it
Hmm.
also builds resilience. That is powerful. That is powerful. Thank you for sharing that. I also just wanted to ask, you hold therapy sessions in your practices as well.
Yes.
And I guess that helps. It's one of the leading ways we can cope with different mental illnesses like anxiety. What does therapy entail? Like, you don't have to go into detail, but then just to tell us, if I wanted to go for therapy, what can I expect? And I guess you can also just touch on the different types of treatments one can go through, because I know in my previous podcast I spoke to people about how I was prescribed antidepressants,
Mm,
the different pills. So what's the ratio between pills and therapy? What works, what doesn't work? I know the
mm.
best the best answer is the combination of both, but I guess you can just tell us, from we can start with the what to expect when I go for therapy.
Okay, so what you expect will depend on the problem and how the problem is diagnosed. Because remember, some people might just anxiety is a normal um, part of life, or some days feeling depressed and down is a normal part of life. But then, depending on the intensity and the
Mm,
pervasiveness of that, then it can become a disorder. And when it's a disorder and really debilitating in one's life, then if you come to me, I will also probably suggest that you do go on medication, either
mm-hmm,
antidepressants, or just anti-anxiety medication, but
mm,
that's never enough, because one has to
mm,
change the way that you think about things. And as a
mm,
therapist, I would then like to notice what the patterns are in your thinking, or what kind of, like, let's say it's anxiety. Okay, now there are
mm,
there are many anxiety disorders. You get generalized anxiety disorder, you get panic disorder, phobic
mm,
anxiety disorder, obsessive compulsive disorder, post traumatic stress
mm,
disorder. Okay.
mm, mm,
And
mm.
I would then like to sort of look at what are the causes of, let's say, your anxiety disorder. So, like, COVID-19 is a threat to us, whether it's, on a physical level, being worried, getting the disorder, or financial, or whatever. It's a threat out there, so we are feeling
Wow.
threatened. And if we feel that, like, we can't fight or we can't flee, then we get stuck, and that is often
Yeah.
the depression. And sometimes it relates to other times in our life where we felt stuck, in a threatening situation. So in this threatening situation, we might um, be more depressed than we would have, so it almost becomes like a complex trauma sort of scenario, you know.
Yes.
So
Yes.
so it would take a sort of a diagnosis, but the aim would be to change the thinking. And there are many methods of doing it, depending on the
Mm,
therapist. So some therapists would do cognitive behavioral therapy. I do cognitive behavioral therapy, but in hypnosis, okay, because I like to
okay.
talk to the subconscious mind and to change the patterns of thinking in the subconscious mind. Or I also like to do mindfulness training with people to help them be
Oh,
in the
yes.
present moment and not in the future.
Mm-hmm.
Okay, and
Mm,
the
mm,
future is like lots of what if thinking, you know.
yes.
Um,
And unfortunately, it's always the negative that we think of in the future.
it's the negative. It's, yes, it's
Mm,
absolutely, or in the past,
yeah.
which then, so future thinking, anxiety; past thinking, or stuck in past thinking, depression, often, you know
Mm,
and I've got specific trauma techniques that I do. One is BWRT, brain working recursive therapy, where we literally um, download a new software into the brain so that you don't
wow.
continue to act in the present based on past patterns. Okay, so
Wow. That is so powerful.
yes,
Don't continue to act in the present based on what you've experienced in the past. That is so
absolutely,
powerful.
yes.
That is so powerful. Thank you for sharing that. So,
Hmm.
I just want to dive into, so obviously we are working from home. You also mentioned that that could be one of the causes um one of the causes for mental illnesses. I mean, if you're working from home and you're not used to it and so on and
Hmm.
so forth. we do like our employers have been trying, they've been doing webinars. I know my
Yes.
employer has, they have live workout sessions that they've organized, but I
Mm,
hardly attend them. I've never actually attended one because I never have time to actually attend it. So
yes.
it was started 4:15. At 4:15, I'm probably getting into a client meeting. I
Mm.
just want to know, what can corporate and basically people that are responsible for the work environments for so many multitudes, what can they do to promote mental wellness in the workplace
At the moment,
at the moment?
yes.
Yes.
Well, Well, they can promote it, but I think as an employee, you must also make use of it. Okay, so the
Mm,
whole webinar thing is a good thing because one can see each other, you know, and I think it's important to see that other people are responding to you by looking at their faces and seeing facial expressions that are responding to you when they talk to you. Okay, but also I
mm,
think smaller teams need to, you know, also get together like for a Zoom meeting or that sort of thing where you can talk, or your closest colleague at work, or
mm,
one-on-one Zoom meetings between you and maybe your manager, where there's just
mm,
that. Let's just sort of connect. Let's just connect with each
yes.
other and see how each other is doing and that sort of thing, or you know
Mm,
sessions with your friend at work, the one that you go for
mm,
the coffee breaks with, for the coffee breaks, or do the lunch with, or go for the smoke break with, just for that sense of connection. And I think companies should promote that their employees do it. I think employees want to know that their companies care about them. So that is what
yes.
companies need to convey, and they can only convey that by connecting with their
Mm,
employees, asking how they are coping,
mm,
listening to their concerns and their, financial concerns maybe, and reassuring them, that they remain part of this family, which is the
mm,
company, and that the company will do everything in their ability to, to ensure just the well-being of the individual employee, you know.
that is good. That, I hope they're listening and they take them
Mm.
into account and they actually use them. Thank you for sharing that. My last question, I guess, surrounds substance abuse and mental health. Can you shed some light on the correlation between the two? And I guess when is it like mental wellness and when is it like an addiction? So I'm guessing just when you're using drugs, I mean, as a coping mechanism, I guess.
Well, what type of drugs are you referring to?
I don't know. I guess we can talk about the healthy ones because some people get prescribed they get prescribed healthy drugs, like, and then eventually it becomes addiction
Yeah.
because then you can't live without. So I
Mm,
shared in my podcast, my previous episode, that I was put on antidepressants
mm,
by my doctor, but to date I haven't gone and actually bought the prescription because I thought that I would have to rely on them
mm,
forever, and the sound of that for me,
mm.
it didn't sound good, because then I don't want to be relying on medication to feel okay for the rest of my life.
Yes.
So I guess just demeaning that and saying so, and then I guess there are people that actually go heavy on the substance abuse, like, the weed, the cocaine, I don't know.
Yes.
Like, yes.
Yeah. Okay. So let's talk about legal drugs. You know,
Okay.
like let's say your antidepressants or your anti-anxiety drugs. Okay. So
Mm-hmm.
anti look, everything, everything is addictive physically.
Mm-hmm.
Like, I mean, if I'm used to 3 cups of coffee a day, you know if I suddenly stop, I will feel some withdrawal symptoms, okay,
Mm-hmm.
physically.
Yeah, true,
Okay,
true, true.
but the thing to be concerned about is the psychological addiction. Okay. So
Mm,
antidepressants aren't psychologically addictive. And what they do is they rectify the balance of our neurotransmitters. Okay. But
mm, okay.
if I'm on antidepressants for a year and I just stop abruptly, I'm going to have physical withdrawal symptoms. Okay.
Okay.
So it's not good for your body to stop any sort of medication, well, like, antidepressants or coffee or cigarettes or
Mm,
whatever it
mm,
might be abruptly, but to wean
yeah.
yourself off. Okay. But that is just
Oh,
physically.
okay.
But one doesn't become psychologically addicted to them. When it comes to anxiety medication, you know, yes, one becomes psychologically addicted to them. In the same way that you would become psychologically addicted as well to alcohol, psychologically addicted to weed or cocaine or anything else. But there are times when I am so anxious, okay, that
Mm-hmm.
I need to take, let's say, anti-anxiety medication, and that is okay. But if I
Okay.
like use one tablet now, and in a week I need to use two tablets, and then I start using three tablets and four tablets, then it becomes a
Mm,
problem, you know.
mm,
Um, but if I use it like if my anxiety is acute and I use it for that period of time, okay, and
mm,
then I say, okay, now I need to start weaning myself off of it because I'm actually feeling a bit better and life is going a bit better. That's great. Okay, so but we have to handle that with care. Same
mm,
goes for if I smoke weed, let's say once a weekend,
mm,
suddenly it becomes every day and then it becomes three times a day, and that is a problem,
yeah.
and I mean,
Yeah.
obviously, drugs like cocaine and that sort of thing, that is just not good for us, period.
Yeah, it's definitely not. It's
Mm,
definitely it can actually contribute to your anxiety and
absolutely.
oh,
Absolutely.
thank
It
you.
can. Mm,
Well, thank you for taking your time to share with us. I mean, I think I actually have one last question. I mean, you are always, I guess, the nature of your job is obviously ensuring that the world is okay. You are the one responsible for most people functioning well. And I
mm,
guess one thing that most people don't actually ask is if you are okay. How are you? Like when you are going through, let's say, different when you're going through struggles or even coping with COVID-19, how do you deal with it? I mean, you are an expert, so I guess I want to ask, how do you deal with it? Firstly, how are you? And secondly, and
very
secondly,
sweet.
how do you deal with it as an expert?
Okay, so what I do is I do a lot of self-care, you know. I believe
Mm,
that's important for all of us to do. And to me, self-care is setting time aside every day to do what I love, something that I love,
yes.
you know. And
Yeah.
when I do something I love, it's to do it mindfully, So I'll
Mm,
have that glass of special red wine sitting on my veranda outside, or I'll
mm-hmm,
have that nice block of, chocolate, or soak
mm-hmm,
in a hot tub, or listen mindfully to music, but it must be something that I love, you know.
mm-hmm.
And another thing that I do is I I create time for worry every day. So I don't allow myself to worry all the time, you know. So
Okay.
I would say, let's say I'm going to worry between 11 and 12, and then I'll worry. Okay. And
Wow.
if a worrying thought comes up outside of that hour, I distract myself, and I say, no, it's only 9 o'clock now, but at 11 o'clock, I'll worry.
I'll attend to you. That is so fun. That
And
is fun. Thank you for sharing.
yeah, yeah. And
That is so.
And there's another important thing also that I do, and that is if I've got questions, because when you're
Mm,
anxious, one asks yourself a lot of questions. Okay, so I've got
mm-hmm,
rules about that too, you know. So
okay.
because often when one worries, you don't answer your own question. You just questions, questions, questions. What if? You know.
Mm,
So I
mm-hmm,
write my questions down, and it's not allowed to be what if questions because that's future questions. It is what
mm-hmm.
is questions. So I can say,
So the present.
yeah, the present. So I can like say, what are the various options available to me now for generating an additional income? Okay, or what
Mm,
strategies can I implement to save money? Not what if I
mm.
lose my job or what if I don't, you know. And
You have money in the
yeah,
future.
and then I
Mm.
answer those questions. I write it down and I answer those questions, and that helps me to feel very calm, you know.
Oh, that is so powerful. Thank you for that. I'll definitely be taking some of those and applying myself. Like set aside time for worry. And if it comes out of that time frame, within that time range, I'll just be like, nope, I don't have time for you. I'll see you at 11 o'clock.
It really helps.
But yeah, it is very helpful. No, thank you very much for taking your time to share with us today. I don't know, do you just want to share with the different where we can find you if we want to get therapy, if
Yes.
that's how it works at all,
Well, you
please?
you can go to my website. It is www.healingthemind,
Okay.
healingthemind.com.
Healing the
Yes.
mind. I'll also put it when we post the episode. I'll just tag it there and then share
Okay.
with the rest of the people. But
Okay.
thank you so much. I appreciate you so much. Thank you for
And
taking time to
it,
share with
it
us.
was lovely talking to you. And have a lovely day.
Okay.
All the best.
You too.
Thank
Thank you.
you.